For manual readings in the office, how many times should they measure?
Standard practice is 3 readings, about 1–2 minutes apart.
And you just average them.
You average the last 2. But if the readings differ by more than 10 millimilli in Hg systolic, you should take additional measurements until they stabilize a bit.
Okay, average the last 2 consistent ones. Now, what about this automated office blood pressure, or AOBP?
Right, AOBP. That's where an automated device takes multiple readings, say 3 or 6 at 1-minute intervals, often while the patient sits quietly alone.
And it gives an average.
Exactly. The potential advantages are that it might correlate a bit better with 24-hour ambulatory averages.
So closer to a true average.
Potentially, yes. And it might reduce that white coat effect, the anxiety-driven spike you see in clinic.
So should clinics switch to AOBP?
The guidelines say clinics should choose a consistent approach, manual or AOBP, based on their setup and preference. The key is consistency.
Makes sense. What about checking both arms? Is that standard?
It should be done at the initial visit. Measure one, then the other. Sequential measurement is fine.
And if there's a difference?
First, remeasure the first arm to make sure if there's a consistent difference of more than 10 millimil Hg systolic.
Use the arm with the higher reading.
Yes, for all future measurements. And a significant consistent difference might warrant investigation for things like arterial stenosis or coarctation.
Okay. And sometimes you avoid an arm for other reasons, right? Like a fistula or after surgery.
Exactly. Patient-specific factors always come into play.
One last thing on office measures.
Yeah.
Postural or orthostatic hypotension. When do we check for that?
Good question. Recommended at the first visit and anytime someone has symptoms like dizziness on standing.
How do you test for it?
Measure BP after 5 minutes rest, sitting or lying. Then have the person stand up and measure again at 1 minute and possibly 3 minutes.
And what defines a positive test?
A drop of 20 millimere Hg or more systolic or 10 millimere Hg or more diastolic. That's orthostatic hypotension.
Is measuring after lying down better than sitting?
Potentially a bit more sensitive, especially for predicting falls, but maybe less practical in a busy clinic setting than measuring after sitting.
Got it. And checking heart rate is part of this too.
Yes, record the heart rate at the initial visit, partly to check for arrhythmias like AF.
Okay, that's a really thorough look at office BP. Let's move outside the clinic.